The following segment is sponsored by Stubbs Dental. Welcome back. Did you know 15% of adults have dental anxiety?
Yes, but never fear. Dr. David Stubbs is here. Thanks for joining us, doctor.
Thanks for having me, guys.
Okay, dental anxiety, we're going to talk about what that is, but it can cause oral health problems for years to come. So it's really important to make sure patients are comfortable and okay coming to the dentist, right?
Yes, there's so many patients that come in and say, I haven't been into the dentist in 5, 10, 15 years
that gives me
because
anxiety.
it's so scary to go to the dentist, and they've had bad experiences where they were open for such a long time, or they just had pain, they couldn't get numb. There's a lot of different reasons. So it put off necessary procedures and then they lose teeth, or they get decay, and so it becomes a big problem for them where they could have saved a lot of their teeth, or they could have prevented a lot of issues.
Yeah.
And they lose a lot of the ability to function and to smile. A lot of things we take for granted a lot of times, they
Just
lose
to smile.
that. Yeah.
And feel good about your smile. Okay,
Yeah.
what kinds of sedation dentistry do you offer?
So the main one that we offer that kind of differentiates us from most dental offices is we do IV sedation. Now there are the biggest thing with that is it's controlled. It's very you can tell how the patient's going to react. The medication goes into the system quickly, comes out quickly. They process it quickly. A lot of offices do a pill. So when you give a pill to a patient, you don't know how they're going to process it. Their digestion, their metabolism, how they're going to metabolize it. So it's just much more predictable when you do it with IV.
An IV, yeah, sure.
And safer in a lot of ways, because then you know what's going in, what's going out, how much they're getting.
This is a great way to make it a little bit more pleasant of an experience.
Yes, if you have that anxiety, which I understand why people do, it can be kind of scary.
Yeah, I guess if you're getting work done, it's not like you're just excited to go in, but you can make it not a horrible experience. The dentist isn't bad.
The best thing that happens, and this happens to us daily when we do sedation, patients will wake up from a procedure and be like, Doc, have you started yet? And we're like,
We're done.
Yes,
We're done. And it's the best feeling for them. You see a sigh of relief, like, oh my goodness, I was so worried about it, and they don't remember anything, and that's the biggest thing. That's the biggest benefit to the patient.
Sure. Okay. What kind of procedures do you recommend to go under general anesthesia for?
So it depends. We've done a wide array of procedures. I mean, we're talking about anything. If they're afraid to even get numb for a filling, I recommend it, because it's going to be a way worse experience being
for everybody involved.
Yeah.
Right?
Just for them. I mean, we can go really slow, but to have to go through and remember the numbness, especially if there's been a bad experience beforehand, coming to our office, like, let's do it. We discount it heavily, so it makes it so it's affordable and they can do it. Yeah, it's a good option. But at the same time, all the way up, we do the all-in-4 procedure. We actually found out that we were the #1 provider in Utah for doing the all-in-4 procedure.
What you're known for. That's so great.
It makes us, it's so bread and butter for us. But we do that for that's a full day procedure for the patient. So
these are some incredible pictures.
Is this the all-in-4 procedure?
A lot of these are all-in-4 procedures where patients got fixed teeth, all supported by dental implants in a day, and teeth failing, sometimes indentures. So our goal is no more dentures. That's our mantra. We say no more dentures. Don't have partial dentures, full dentures. Let's get rid of them.
Yeah. You guys have a great deal going on too.
We do. So we offer a lot of our. We say, we have this % off, this % off. We're offering $10,000 off the all-in-4 procedures, which if you've done your research and looked into it for those patients, and this is, a certain, maybe a certain part of the population, but if you've done your research and looked into it, that's a huge amount of savings. So
that's amazing. Dr. David Stubbs, thank you so much for coming.
Thanks for having me.